Okay.
All right, here we go. Rod.
Okay, we're going to talk about physiology of greyhounds because it is different than other animals, and it explains some of the things we see that are normal in greyhounds and some of the disease processes that they suffer from. And one is general blood pressure. Dr. Kuto made a comment that he was going to try to sleep on the couch with his greyhound and in the middle of the night slip a blood pressure cuff on and see if he could record a normal pressure, because he had never seen one in the exam room. Now, normally hypertension can lead to strokes and actually kidney damage as one of the most common secondary problems. But greyhounds can have kidney damage, but it really appears to be a primary renal problem and not related to systemic blood pressure. So the point is, if there's blood pressure measured and it's elevated, the dog probably does not need blood pressure medications. Now, you might do a cardiology workup on them looking for heart disease, but that's going to be extremely rare since these dogs were genetically selected as performance animals. So unfortunately, very few of the ones with cardiac potential issues ever got through to the breeding program. The other thing, they have an elevated creatinine, and blood urea nitrogen and creatinine are two nitrogen waste products from eating and metabolizing protein. And it is 100% normal to have an elevated creatinine. If we see it in most dogs, we think they have underlying kidney disease. And if it's significantly elevated, we think those dogs have less than 50% of their normal kidney function left. But creatinine comes from muscles, and greyhounds per pound have a whole bunch of muscle. So creatinine levels that might be 30 or 40% out of the range of normal animals. And it will show that on laboratory testing as an abnormal. So of course it has to be right, but it doesn't apply.
Dr. Poling, what about the other kidney value? It starts with a B. It's escaping me right now. They're always together.
Yeah, blood urea nitrogen.
Okay,
Yes.
but there's one name for it, and I'm wondering if that's normal too in greyhounds.
Yeah, BUN or blood urea
That's
nitrogen.
it. Yeah. BUN and creatinine.
Those are normal, because that's just a measurement that's much more relying on filtration through the kidney and hydration, where creatinine is much more serious when it's elevated and is indicative of typically loss of kidney cells, except in the greyhound.
Fascinating.
The other thing they may have, in fact, I would say most do, a low white cell count. And when we would see that in a normal animal, we would think of a viral infection that is stimulating that response. The total proteins in the blood, so globulin and albumin. Albumin is the protein that keeps fluid in blood vessels. It will be on the low side of normal. Platelets, clotting elements in the blood are also low. Also, thyroid function is probably 25% lower. And I can certainly remember doing a complete chemistry on one of the early greyhounds and saying, oh, this guy's hypothyroid. Hypothyroidism is typically, well, it's an autoimmune atrophy disease. So this autoimmune inflammation damages the thyroid gland, and it produces less and less hormone until it's in an abnormal level.
Wow.
And what happens to it? Metabolism lowers. So what we're going to see is a dog that's prematurely lazy on a good diet, if not a restrictive diet, if not a weight-reducing diet. They gain weight. Every season that they have a seasonal shed, they lose symmetrical areas of hair, and it doesn't grow back. So we see a fat, prematurely aged, bald animal with a slow heart rate that will sleep on concrete in the sunshine in a 90-degree day. So it's totally abnormal. And I have never seen a greyhound that truly had hypothyroidism, although the test says they do. They also have two humoral antibodies, IgA and IgG, that are on the low side. That's more of a veterinary thing, because we'll look at that and think they have some immune problem where they can't produce antibodies to fight infection. On the opposite side, the high levels are red blood cells. And we describe that as hematocrit or packed cell volume. just take a volume of blood and spin it down. What percentage of that volume are red blood cells? And normally 38 to 42, sometimes up to 50, and that too is dependent on hydration, but it's not uncommon that greyhounds would run 50 to 70%. Now, if a human was running, especially a professional athlete like a greyhound, was running a hematocrit of 50 to 70%, that is exactly what would show if they were red cell packing. In other words, drawing blood, filtering, probably preserving, storing it, and before the big race, get a little pump up of red cells.
Oh, Finnish. Yeah, Finns do that. The Finns
Yeah.
do that.
Yeah.
Right.
So, and why would a greyhound have that? Well, as Dr. Kuto says, they have the speed gene. So they picked those dogs that actually had a genetic defect to have higher hematocrits. Keep breeding them together, pretty soon that's normal.
Wow.
And when we talk about genes, the comment was made, well, why are these dogs so different? And the reason is they're selected for one thing and one thing only. And since 1908, when the racers were thrown out of the AKC, because obviously the blue blazer guys didn't want these hillbilly racers involved in AKC, they are separate and distinct dogs. They look the same, but they do not have the same diseases. And these racers have these diseases because we've selected for 110 years, 120 years for one factor only, and that's run like a maniac.
Wow. They do that
So
well.
86% of greyhounds have heart murmurs. And so we typically think of that as cardiac disease, but it's not the case. And what Dr. Kuto says on all the blood pressure measurements that he does, if we compare a golden retriever of the same weight with the greyhound, the aortic velocity, the velocity of the blood as it leaves the heart, is 50 to 75, sometimes 100% higher. And that high velocity output creates turbulence, and that's what a murmur is. So it sounds shh, 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 shh. And what's unusual about it, if you move the dog's neck to the side, the character of the murmur changes. So think of the aorta as a big tube, high pressure tube coming out of the heart. And if it's got a couple 100 pounds of pressure per square inch, as we twist it, turn it, and manipulate it, the shh, 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 swishing sounds are different. And when I first heard that, I had the same feel. But then after 86, 90% have the murmur, it's like, hey, this one doesn't have what's normal? Well, the murmur's normal in them. They also lack a very specific protein, or almost all of them do, and it's called DEA1, and that makes them universal blood donors. So they're kind of like type E people. And that's one of the reasons, not only are they big with lots of red cells that you can suck out quickly, they seem to regenerate quickly, and not having that defect, they're almost universal donors. So that works. Now, in talking of some of the defects that could be related to some of the things we just talked about 1/3 of all greyhounds have a bleeding defect, and they could be cut. They could have an injection of an antibiotic. Dr. Kuto tells the story of a dog getting a microchip, 3 millimeters by 1 millimeter, and going to the emergency center that night and having 10 units of blood transfused.
Oh.
So what happens with these is it's not immediate bleeding. And I can remember seeing this early. We would do a dental cleaning, stitch everything up. The dog recovered, no bleeding. 4 hours later, the gums are seeping blood. And all we did is put a Cavitron or a scraper up under there and cleaned under the gum line. So what happens is they have platelets to stop the bleeding. And platelets are cells in the circulation that literally, like a sponge, that they stick together and will quickly close a bleeding defect on an artery or a vein. But what happens is that clot doesn't mature, so those platelets fall apart. And normally what happens with the clotting mechanism, there are proteins that are mobilized, gluing those together, making the platelet clot into almost a little piece of scar tissue. And then the clot is thoroughly capable of stopping bleeding. So that's a problem when 1/3 of them can bleed. And that's with minor procedures. So if we're doing something like a splenectomy or a broken bone or a cancer surgery, it wouldn't be uncommon to see them bleed to death. And there's been a lot of studies done on it. What's also unusual is normally if we anticipate the potential for clotting problems, we do a clotting profile. It includes a whole battery of tests, a platelet count, a thrombin, a prothrombin, factor VIII. So all these different factors that have to be there in the right sequence at the right time to cause bleeding to stop. Greyhounds have normal clotting test every time. So that there's a defect in humans that is probably similar because it's treated with the same drug, and that's
Amicar.
Yep, Amicar or aminocaproic acid. And so the thought process is every Greyhound ideally should have it a day before the surgery, the day of, and 3 days after.
Wow.
And that solves the issue. And since there's no test, it's not like, okay, 1 out of 3, you guys are going to bleed. We're just going to give it to all of them. And it's relatively inexpensive and relatively available. I know at one time we had to have it made by a formulating pharmacy with a very short date. So you'd buy $100 worth of it and throw $82 of it away. But it's now, the Amicar is the brand name, and you can get it everywhere.
Dr. Poling, I don't know if we're allowed to interrupt, but I have been in close, excuse me, should I wait?
No, yeah, go ahead, ask the question if it's related.
I have been in close touch with Dr. Kudo, and the reason is this. I was sponsoring a Greyhound in Florida, and by sponsoring him, I mean I paid all his medical bills, and he had a dental. And about 2 weeks later, he started internal bleeding. And even Dr. Kudo says that this was a very unusual case because this dog went on to develop, what is it called, hemangiosarcoma. And he eventually died, but he lived for 6 months because Dr. Kudo called an Amicar to the vet and insisted that they use it. They had no knowledge of this whatsoever. And also in relation to Gail Reichert, who lost her dog Franny recently, this is exactly what happened. She went to a non-Greyhound vet and had a dental and bled to death, was dead, I think, in a day and a half.
Now
So people need to know this.
Yeah, your Florida dog had hemangiosarcoma. That's a malignant tumor of the lining of blood vessels. So
Right.
those tumors are there literally years in advance of the spontaneous bleed. And when they bleed, it kind of looks like a little cluster of grapes, one little hemorrhage on one little hemorrhage on one little hemorrhage. But if they're a Greyhound, you're 100% right. Talk about the need to have a quick clot. In fact, that's what happens. They eventually use up all their clotting elements and bleed to death with the next little aneurysm. But that's probably an on and off thing that's multiple months. So that absolutely any potential bleed in a Greyhound, small cut, even a toenail that gets ripped off, I would use the product. If a microchip can cause them to require 12 units of blood to survive, I think you treat everything that looks like it might bleed.
Wow.
Now, the Greyhounds also have another syndrome where they have too much spontaneous clotting. And this is a syndrome that Dr. Kudo makes the joke. A Greyhound owner should never leave the house without aspirin in their back pocket. We had a dog that was in a park playing, one of our clients fell down, totally paralyzed, went to Tufts. They found with an MRI a 12-inch clot in the aorta. And they were about ready to put him down. Someone said, wait a minute, I've heard Greyhounds have this. They checked the literature reference, started the dog on aspirin, and he was standing the next day, discharged 2 days later.
Fabulous.
So, but what Dr. Kudo said, and the amount of aspirin is minimal. If it's an acute onset, 81 milligrams aspirin, that used to be called the child's dose, baby dose, cardiac dose, low dose. And then once you see the response and know the dog has that potential, then just a half a day and they won't have it happen again. I've seen it in another way that I think I've seen 4 dogs with it, and they came to me because they had intermittent leg lameness. Sometimes it was the same leg, sometimes it was shifting leg lameness. So they had an orthopedic guy look at it, normal. They had a neurologist look at it. They had an internal medicine person. They took they did pressure studies, nerve conduction. And so what happens, these dogs it can be consistent and last for months, or it'll last 2 days and go away with no treatment.
Sorry.
So after I review these records where they've spent $6,000 telling you what it isn't, we start them on a aspirin, and they never have the lameness again. So that's pretty interesting to see that subtlety.
It's fascinating.
The other thing that is, I know, unique to greyhounds, although I'm seeing enough strays here, I'm looking for it in other breeds, and that's what is commonly called malignant hyperthermia, which is really an anxiety attack. And these dogs will come into the office, and after I saw it the first couple of times, I instructed my technicians, when a greyhound hits the front door, get them in an exam room, take a temperature first before you say hello. And if it's above 103, come get me immediately. We'll recheck it in 1 to 3 minutes. And if it's elevating, we're taking that dog down and starting an intravenous sedative, a very potent narcotic called torbagesic, injected IV, start cooling that dog off.
Wow.
I had 2 dogs, and one of them, so we check it, it's 103.6. We just stood there and put it in again, 104.2, 105. So we're rushing that dog down to the treatment room, put him in a sink, cold water, ice packs, intravenous sedatives, and we went ahead and anesthetized the dog. He was thrashing around, having a short seizure. And the temperature on a rectal thermometer will only go to 110. He pegged that thing. And so then he was anesthetized. We started 2, 3, 4 IVs with cold packs around them. We did a cold water enema. His temperature started to come down. And the problem with that is if the brain's been swollen and inflamed, they may lose the ability to regulate temperature. So now they go 105, 104, 103, 99, 87. Oh, big problem. So we shut this guy off as soon as we saw him going down, and just took him out and dried him off and leave him in an air-conditioned room. And after we anesthetized him, he woke up and walked out very relaxed. That and a whole bunch of narcotics.
Right.
Scared the hell out of
You
him.
must have been a wreck. The dog is fine.
Yeah, I mean, to say the least. And then
I'm amazed any of them survive.
Well,
you know, there's so much that people don't know. I didn't know that.
Well, and I couldn't believe it, because the technician said it's 103.6 and he's been here 5 minutes. And then when it was 104.2, like, what the hell? And I had heard something from Dr. Kuto about it, although it was in relationship to a question. So I knew something about it, but then when I saw it the first time, I really knew about it. I had another dog that we stopped at about 104, brought him outside in a fresh snowbank, and he came right around. I think getting him out of the hospital was important, as throwing him in a snowbank, but it makes a good story. And
Sure.
Yeah.
then I had
Yes,
another
yes.
dog that went to 108. So the book says they will not survive beyond 106. But see, I think this was so acute that it wasn't like their brain was 110 for any period of time. I mean, we were literally putting them in a freezer. So what's the message? If we see a dog that has great anxiety, I would make sure he has anti-anxiety drugs to the degree that it's controlling his home anxiety to a great extent before I brought him to the hospital. And I would insist the doctor take a temperature immediately. Now, I've seen 5,000 greyhounds. It's happened 3 times. It certainly made an impression on me.
would it, as I remember, sometimes you used to like see nervous dogs in the car, so they didn't even have to come in to the practice. Yeah.
So if they need to see the veterinarian, just take that temperature, because he may be panting with his eyes bulging and salivating like crazy and pacing the floor, but he might be 102.7 too. And so why do dogs have that problem? And it certainly is an anxiety initiated thing in a greyhound, but they are extremely inefficient at getting rid of body heat. They sweat from their nose and their feet. So that would be about 1% of their body.
Yeah.
The other thing is breathing and panting. A dog's perfect environmental temperature is 50 degrees at 50% relative humidity. And so, we're going to be 65, we're going to be 71, and we think we're pretty cool. Now, that would maybe be a golden retriever. I think these guys like hot a little bit better because they have no body fat. They've got thin skin and hair pretty thin. But what's their normal? It might be, they're perfect. It may be 60, it may be 65. But it's a problem. So I think that's why they just go 0 to 110. That they don't have any coping mechanisms. But once the brain gets a little extra heat and that temperature regulating part of the brain gets damaged, it's over.
Dr. Poling, I have a quick question. I hate to interrupt, but I can't see who else is participating right now. My older greyhound, Shona, is now 13. And when I take her into the vet, she quakes. We have never checked her temperature.
The interesting.
I'm wondering.
Now, she survived it, but I think this is more in younger, anxious dogs.
Okay.
The dogs that might be their first trip to the veterinarian. Now, I saw dogs that went to 104, and then we gave them the intravenous Torbagesic immediately and just kept a thermometer in them, and they stabilized. So then we just said, okay, we're going to make this a quick visit, and when you come back, we're going to use gabapentin, we're going to use acepromazine, we're going to use Torbagesic, we're going to use some combination of anti-anxiety drugs before we even see you. And we're going to make an appointment so that we know there's not going to be any wait. We're going to take you from the car to the exam room to the thermometer in one big swoop.
Rod, you'd be interested to know that Janet Taft is on the call. You're
oh, Janet, hi. It's Kathy.
And she was a student with Rod. So there, another connection. Welcome.
Fascinating. Well, I'm thinking twice now about bringing Shona into the vet. She doesn't really need much with regard to vaccinations anymore because she is 13, and I bring her in to have her nails done. I'm thinking I'm going to have them done out in the car because she really quakes.
Right.
But yet again, she's 13.
Get rectal temperature, and you tell them what's the right thing to do.
Yeah. Well, this is with Liz Hartman and Janet. But, luckily nothing's happened.
Why don't you have Mariah come over and do her nails?
This is,
I might.
Janet, it's Carl, by the way.
Okay.
Oh, Carl, hi.
Yeah, and I'm not a vet. So.
Oh, Carl, it's you.
But you're interested.
The other thing, I went to a conference on vaccines, and certainly most veterinarians are now recommending, rabies, as law requires, every 3 years. The distemper combination, at least 3 years. And the speaker said a dog that's been properly vaccinated at 13 years of age, on all the immunologic studies she's ever done, they do not need additional vaccines. They are protected. And
I don't think she's gotten some. I think that's been the advice that they use at Wellesley Animal Hospital.
I think it's right. Well, we all know vaccine reactions and autoimmune inflammatory processes, they can be life-threatening. And I have never seen a dog break with distemper, hepatitis, parainfluenza, parvo after they've been properly vaccinated, even as long as 5 and 6 years later. I did see a cat that had 5 vaccines that came in at 17 years of age. 5 vaccines were given before 10, and it became an inside cat. So they stopped vaccinating it, right? That cat's not going to be exposed to rabies. They had bats in the house. The entire family and 2 of my staff members were exposed. That sucker. So they don't last forever. but they do last 3 years.
Okay.
Uh-huh.
Let's talk about hookworm. Have anyone ever seen a greyhound off a track without hookworm?
No.
I would check the validity of my fecal test. And I thought that the thought process was they're raised on soil, some of which has been used as greyhound breeding farms for 50, 60, 70, 80 years. In New England, hookworms will live in the soil at least 20 years. In the South, they will live indefinitely. In fact, there's a condition in the South called creeping eruption, and it's hookworm larvae that penetrate the skin of people that walk in that soil that's contaminated without. So it's a
Even
poor
if they
hygiene.
have shoes on?
Well, if the soil contaminates the surface of the skin, those hookworm larvae are going to be microscopic, so they can't enter. Now, I've seen many dogs that had come to another veterinarian or even to our practice, been treated for hookworms and continued with bloody diarrhea. And I saw them 2 weeks later. I would prescribe another therapy thinking we wormed them 2 weeks ago, and send a fecal positive. Worm them again. 2 weeks later, positive. They might go negative for a few days. So they have so many larvae, and what should happen with most effective medications, they purge the intestine. Well, what that does is trigger the immune system to allow those hidden larvae that could be in the brain, the muscle, the liver, the kidney, everywhere, to mobilize, get back to the intestine. So another wave comes in. Now, what Dr. Couto, after looking at a good number of those dogs, he says the pyrantel that we use is resistant in something like 15, 16, 20%. Panicure, which is the pyrantel broad spectrum replacement, has some resistance. And moxidectin, a new product that's in a heartworm flea combination, tick combination called Simparica Trio. He thinks that's one that still works. And it was, so we might actually worm these dogs serially every 2 weeks with a different product. And I left a dog at Brookline that we were worming every 2 weeks for a year, and then we were going to see what was happening. But I think this is exactly the answer. I should have been rotating those drugs.
What about Drontal?
Well, it wasn't listed in the ones that he used, but it's a broad spectrum one that should certainly be considered. Very good product. And I think it's used less than Panicure, so it makes sense. It could be better, but I don't think there's been any testing.
Dr. Poling, you gave us a preventative that Bonnie took for a long time. No, it wasn't Simparica, and it used to cover different kinds of worms and ticks and everything, and I can't remember what it was called. And we had great success with it. Both of our last two.
See, that has most of those products have a praziquantel. So what had happened is, I think it was the FDA, or maybe it was probably CDC. They see enough ectopic dog parasites in children, and not just a creeping eruption, but mostly roundworm. And the larvae don't complete their life cycle, but they might get in the lungs, creating allergic asthma, in the brain, causing seizure activity, in the eye, causing blindness. So, and it's mostly children because of undeveloped immune systems, and they probably eat more dirt than the rest of us. But
I hope so.
So the theory now is these heartworm medications, many of them have flea, tick, heartworm, and at least 4, if not 5, hookworm, roundworm, whipworm. I don't think any tapeworm.
That's what that's the one you recommended that did all of that. And we, like I said, we had great success with it. I'm sorry, I just don't remember the brand name.
Well, but what I would suggest is you probably were lucky and we didn't have resistant heartworm. So once again, the doctor looks like a hero. Don't know what the hell. Trying to figure it out on the go.
Oh.
Could I just ask a question, Rod?
Yeah, sure.
How many more topics do you have? I'm trying to just figure out, should we intersperse questions now? I mean, it's entirely up to you and the people participating. I don't know.
I wanted to talk about corns because in my research, I actually learned something
Okay.
about corns.
We should definitely
So-
talk about corns. Yeah.
Yeah,
Okay.
okay. So we'll whip that one up, then we can do the questions.
Okay. Wait, whatever works for people. I don't know what the time frame is.
Yeah, but pads are keratin, which is a structural fibrous protein. And fibrous might, in our thought process, more feel and sound like a scar. So it's thick, non-vital tissue. It's dead tissue that's protective. Now, when you irritate it, it becomes even more scarred. And that's what a corn is. It's irritated keratin.
Really?
So in humans, people develop corns many times from wearing ill-fitting shoes or stylish shoes that really shouldn't be
Worn.
used all the time. Yeah, or they shouldn't be. I mean, if you're that vain to develop a corn, I suspect there's other problems going on. And in dogs, 80% of the corns are on the central two toe pads because those are sort of the drive wheels. But some dogs, depending on the anatomy of the foot, might drive from all four. And if you look at greyhounds, some of them have what looks to be two more prominent toes in the center and two accessories that are just set back a little. So I think that makes sense. And it is mechanical irritation. I remember talking to Dr. Kuto about it, and I said, how about these dogs that train on hot sand in the south all winter? Would that be something? And he said, yeah, maybe, but no one's done any studies. So some interesting studies have recently been done. And one, University of Tennessee, they found papillomatosis virus. Now that is a contagious infectious virus typically seen in young dogs that causes warts. And these corns have some of the physical characteristic of warts. Now, it was found on 4 dogs out of 20 with corns. So that just may mean that they're chronic carriers of papillomatosis virus. But there's a study now in England being done, taking a closer look at that. The mechanical pressure theory makes a lot of sense if we think about those center toes being the drive wheels and the kind of training and workload that these dogs have. So they're not wearing tight shoes, but they're really putting those toes and pads to the test. So, they also are very deep. So they're not superficial. They kind of look like it, but they go all the way down to the flexor tendon. So the way they might be treated, file them down, sand them. They talk about hauling them out with dental tools, just taking this protrusion of hard tissue and taking it down so you're walking on the softer part of the pad. And at least as long as it's filed down, the hard part is not in contact with the hard surface they're walking on. And I've had clients use X-Acto knives, single-edge razor blades, sanding, the Dremel tools. Yep. Now, I think you got to be kind of careful with those. You can get into some pretty viable tissue, and that dog might have something to say about it.
Right.
At one point, I heard about actually using wart cream because it's a karyolytic. And see, that kind of makes sense if that theory of the papillomatosis virus would work. But I think it was much more of a practical, physical thing. We'd just put the acid on the wart and kind of just destroy its integrity, and it would fall off. Surgically, and I read a reference that said surgery is the most definitive way to get a resolution. So I would cut those, take a big wedge out of that toe, get the entire corn down to the flexor tendon, stitch it together. Now, that was great fun for the dog to walk on that for the next 30 days while it healed, because with every step, that tissue wants to spread. So it was difficult to get it to heal. In Europe, they were actually amputating the joint or removing the nail. So the idea is that, once again, if you amputate the digit, it sure takes care of the horse. I guess they could have cut the leg off, and that could have solved it too, but that sounded a little drastic. But in Europe, they're doing now, in UK specifically, a flexor tendinotomy. So if you think about the flexor tendon allowing you to pull your fingers towards your palm and flex, essentially when they cut that tendon and take a small portion out, it makes that finger stick up. So that corn is no longer on the hard surface. Now, I think that wouldn't work if you had, and I've seen dogs with 4 corns on 1 foot.
Oh, funny.
So, and it also won't work. So essentially the conclusion is there is something that will help, and it's kind of unique because you need to look at the anatomy of the foot and try to decrease the pressure. This flexor tendinotomy thing, though, if it's just a single one that's extremely painful, that sounds like a pretty good little trick. So the toe sticks up a little bit, but it's not painful. And I've seen these dogs so painful, they can hardly go out to pee. They'll pee in the house. They don't want to walk. And then the associated inflammation with it, it doesn't respond to NSAIDs very well. It requires a surgical procedure. So,
I had one greyhound with warts, my
Yeah.
third one, and that's why I took him home, because he kept walking with one paw up,
Yeah.
and he needed to be adopted, and so I
Yeah.
took him home. And in fact, you might have been the one who fixed it.
I think I did. I hope
His name was Dana.
Yeah,
Hope
I hope it turned out well. I don't think.
Oh yeah, you know, it was fixed relatively quickly, and it never came back.
And some can come back, but I think the reason is you don't get all the keratin tissue, so you leave that pressure on that tendon. And let's see, I think I just had 7 potential ways to cure it. So obviously we don't know what the hell we're doing. That's pretty obvious.
Well, you learn.
But we're trying to figure it out. So we can talk about anesthetic sensitivity, cold tolerance, bloat, cancer, or just questions.
Should we take a vote?
What time is it now? I don't have a clock with me.
What time?
5:45.
Quarter to 7.
5:45. I know I have 2 really important questions to ask, but I know that Joanne does as
that's
well.
fine. Oh, no, that's okay. And then Lynn had a question that she put in the chat, so we have one from her. What we could.
But why doesn't everybody get one question, and then we'll rotate again for a second question if we can.
Okay, and then what we could do is, if you'd like, if people would like, we could have, we could keep having Zoom meetings. It doesn't have to be just one. We'll see.
Morty, what did
Kathy,
you
why
do?
don't you do it first? Let's go.
Okay, so I have, she's now 6. She is my 13-year-old. Please turn that off, Morty. She is my 13-year-old's 15th puppy, and her name is Sugar Ray, and I got her when she was 2. And just within the last year, she has developed 2 very weird things. One of which is her toenails fall out. And it's been really hard on everybody, because when it happens, generally she's been outside running or just even walking, and the nail will have come out. She'll come in, she'll bleed everywhere.
Yeah.
And that makes me worry about, we're not using Amicar here. And we're down to the point where she only has 2 original nails. And her other nails have all grown back, kind of one by one. The last one was a whopper because she bled everywhere. And what they've done, this is Wellesley Animal Hospital, she is on 3 things. She is on omega-3 fatty acids, she's on niacinamide, and she is on vitamin E. Twice a day, a lot of each. And they're growing back, looking fine. And I think we're going to lick it. But isn't that a weird thing? And what is it?
No, I don't think it is a weird thing, because I think I've seen it. And when animals are on extremely poor nutrition, their hair falls out, nails fall off. So, and I would go back and look at hookworm on that dog. And
well, you know what? When you were mentioning hookworm, it made me think. I know that she had to have repeated treatments when I first got her. In fact, I bought her from a transporter, Freddie Fulcino. I took her right to the vet for a worm test even before I took her home. I think she may have had a repeat, and maybe I will do that again. But she also, go ahead.
No, go ahead. I think, I don't care if it was 2 weeks, 2 months, 2 years, or 10 years.
Let's do it again.
Greyhounds must have fecal flotations done properly at least once a year, and I would think twice. If they've had it before, I would do it twice a year. I think it's always, they're looking for a reason for hookworm larvae to be mobilized.
So but here's the other thing. She also has this very weird thing called protein losing enteropathy.
Ah, excellent.
And she is on very special food, very expensive, hydrolyzed food, both dry and wet. She eats it well, and she still wasn't processing protein correctly. So Liz Hartman added budesonide in thinking that her stomach lining was inflamed. So she's taking that once a night. And by the way, I've got to shove it down her throat because it can't be chewed. Could they be related?
Well, you see, hookworms are a nutritional stealer, or they create enough inflammation in the gut that you're not getting the nutrition. Now, a protein losing enteropathy might be caused by an underlying allergy, food allergy, an infiltrative disease that is a simple way of saying something's creating inflammation. And so the protein and all the good nutrients can run out the other end. Those nails are glued to that bone by proteins. So
Why doesn't that make sense?
And I would also look at liver disease, where the proteins are converted to the myriad of proteins that the body needs, albumin to keep things in the blood vessel, hair quality, skin texture and strength. It's nutrition's a big thing. So diet, and
I wondered if they were connected because they were so weird together. And Wellesley Animal Hospital has this newer vet, but she's been there a while, who studied at the University of Glasgow. And all I said to her when she saw Sugar Ray was, she drinks a lot of water. She did this test, and up it came. And we retest her probably every 2 or 3 months. The last month was the first time her protein was normal on this special diet with the budesonide and everything else, and her nails are growing back in okay.
All right. So the other thing is, when we see a protein losing enteropathy, check the urine, because half of those
we
dogs.
Did. It was normal.
It was.
But it was dark. It was dark, but it was normal.
I don't care about the physical appearance of it. There's a test called a protein creatinine ratio that speaks to inflammation.
Okay.
And that's another way to lose protein. So you either don't absorb it, you don't metabolize it and alter it in the liver, or it leaks through the intestinal tract or the kidney. And I'm sure there's other methodology to cause some of those nutritional deficiencies. Those would be the first 4 I would look at. And then
they were worried about her kidneys, but they seem to be okay.
Yeah, well, and half of them don't have it. Now, what I was saying about these dogs being hypertensive, Dr. Kuto did a specific study that showed the hypertension in the bloodstream didn't seem to cause problem in Greyhound's kidneys, which it would in you and I and in most other dogs. But he did say that there's a subset of dogs that seem to have protein losing nephropathy, and he just did a study to show that it was not related to hypertension.
Mm-hmm.
So there's still a lot of unanswered questions what causes it.
You know, Dr. Poling, I may call you separately one day and just rehash all this. I think we're on the right track because she's better.
Yeah, the people at Wellesley are definitely doing a good job there.
Oh, I've been going there for decades after I left you.
Well,
so, but this one dog is weird, and she's the youngest I've had.
If I would have saw that dog, I would have loved to have a toenail, and probably would have anesthetized and scraped the bone, sending that to a pathologist, because systemic fungus can also cause. I also saw a dog that had gone to a veterinarian to have a surgical procedure, had its nails trimmed, and the owner said, I want them short. I want every one of these nails bleeding. The veterinarian used an electrical cautery to stop the bleeding. Dog was under anesthesia. Over the next 4 months, every nail fell off. They fried the damn things.
Right. Okay.
And so, pathology would have shown that as well. So
Okay.
you would have had a definitive answer that that was a thermal burn or a fungus or a chronic bacterial infection.
Well,
Or,
she's due to lose 2 more, so
okay.
Okay.
But
she has two original nails is all she has left.
yeah, and see, typically, if the coat was bad, the nail didn't have a nice fibrous, almost rubbery look to it. It didn't have a nice shine. I would think nutrition.
Okay.
So,
Okay.
okay.
Could we
I don't
have
want to hog
Joanne
the
next?
time.
Could we have Joanne next, please?
Yes.
Yeah.
Or Lynn. Lynn had a question too. Sorry to be.
I'll stand till.
No, fine. I've hogged
Okay.
a lot of time.
Disregard
That's okay.
my chat question because my other question is more important. We have a greyhound who just turned 7, who was diagnosed last summer with inflammatory bowel disease, and has had multiple hospitalizations, multiple problems over the past year. She had an ultrasound about 2 months ago that was not diagnostic because she had been so anxious that her stomach was filled with air, so they couldn't visualize as well as they might. Now they're suggesting doing an endoscopy as they may find something that's treatable. She's currently on, she's been on other antibiotics. She's currently on Tylosin tartrate, 850 milligrams twice a day. And she had 5 really good days, but then had an exacerbation again 2 nights ago, and was given Serenia intravenously and is feeling better.
Okay. So, hookworm, no, not really, but yes. Make sure that sucker doesn't have hookworm. I tell you. Now, so what is inflammatory bowel disease? The intestine becomes inflamed, irritated, and it could be quite mild, where the dog looks like it has a hair trigger intestine, and every time you give it a treat, the stool has different quality. Or it could be so severe and persistent that the intestine is now a tube of scar tissue, and the stool is never normal. So if we think of normal intestine, it has these thousands of plications that look like they have hair on them. Those are all absorptive surfaces. And with even short-term inflammation that you cure, something like hookworm, those absorptive surfaces are damaged. So the plications can fill in and be blunted, and the hair's off. So you've lost 50% of your absorptive surface. And if it's an ongoing process, that continues to progress. So we describe inflammatory bowel disease typically as infiltrative. What type of inflammatory cell is infiltrating that gut? Is it allergic? Well, now I'm thinking food allergy, parasites. Or is it a lymphocyte, a lymphocytic, plasmacytic, non-specific inflammation? And at one time we had a scope, and there was a famous gastroenterologist who just happened to sell them. And he was saying we should scope everything down the throat and up the butt every time.
Oh,
Other than malignant lymphoma, it was lymphocytic, plasmacytic, sometimes eosinophilic enteritis. You know what that means, guys? It's irritated.
yeah.
So I knew that is pooping on a carpet. Now, the negative, the positive of a scope is you can get an answer and you get more pieces. But for deep-seated disease, you could miss it. And so I actually just went to a conference on this, and the guy said, when I do a scope, I put it up the rectum as far as it goes. I put it down from the stomach through the intestine. I want to get 40 to 50 biopsies on every location. And I want every one of them done, because it may be patchy and you miss it, but you're only getting a little superficial bite. So if animals are losing weight and they're not resolving with drugs, then I think they should be opened up and get multiple full thickness biopsies, because you got the whole picture and you're not going to miss anything. The other thing we do a lot of times, though, is response to therapy. So we know they can't digest food and absorb it properly. So what happens is all those unutilized nutrients feed an overgrowth of abnormal bacteria. So drugs like Tylosin, metronidazole, they reduce irritation by controlling the bad boy bacteria, if you want to think of it that way. And then we can, at the same time, use prebiotics and probiotics to feed the good guys. And I'm going to say half the dogs respond to that. And consistency of diet. You know, if you find something works, don't screw around. Just and the diets now, Hill's Biome, it is high fiber, high digestible, bland, prebiotics and probiotics. 86% of the dogs will have improved stool, or you'll solve the problem.
Yeah.
And, you know, is it in the small intestine, the large intestine? Different therapeutic approaches. Many animals with inflammatory bowel disease become deficient in B12 and cobalamin. So that'll help them. And so it seems you got that biopsy, now you got the plan. Or you just keep screwing around with these response to therapies. And as long as they're not losing weight and they're not worse, then I'll play that game. But they start to lose weight, stop right now. And check hookworms first and last and in between.
Yep.
Thank you.
Okay, thank you. Okay, Joanne, you want to talk about Bonnie?
I do. Bonnie was diagnosed on September 3rd with osteosarcoma in her right front shoulder. And at the time, we've been going now to Dr. Bagelman in Foxborough. We love him. He seems to have a lot of good Greyhound knowledge, and people that we knew through Greyhound friends sent us there. So anyway, he said it could only be a couple of months. He thought it was pretty advanced. So here we are 8.5 months later, and she's still with us. And
Yay.
I know, it's every day is great. She's still eating. She's still happy. She loves to go for rides. She doesn't want to walk much, which is fine with us. And she still tries to get away from us and run, which she's done. Everything seems to be good. And a couple weeks ago, we noticed under her tail, we thought she had a sore. It was just little bits of bloody stuff showing. So I decided to take a really good wash rag and clean it off. And I said, all right, there's nothing on her tail. And I looked, and her vulva seems to be a little swollen. And I took a paper towel and touched her vulva, and it was a pinky mucus. And every once in a while, there's a little drop of blood here or there. Now, we don't know, is it cancer related? Could it have metastasized to her, you know, whatever's left? Or is this a whole separate thing? And given the state of her health, should we have her examined? I mean, could it be an infection? Do you have any ideas, Doc?
Well, what I would say about the cancer is by the time the dog feels it and is limping, it's already in the bloodstream. Because where do blood cells come from?
Yeah.
Well, that bone marrow. So those cancer cells are circulating. Now, the primary location is usually where the leg ends up just falling apart. So scapula is a good place to have it because it really isn't weight bearing. I mean, and it's attached by muscle.
You're talking about the shoulder. Ah, okay.
Yes. So you're going to get it. Or actually, the skull seems to be even slower growing, and you don't walk on your head.
Yeah.
And so where do those tumors spread? Where the circulation is the best. That would be lungs.
Yeah.
Liver number 2, but I don't think they live long enough it gets to the liver.
Yeah.
And since blood goes everywhere, it would be and we see this with hemangiosarcoma, so it's exactly the same concept.
Right.
Why is it liver, spleen, kidneys, right side of the heart?
Yep.
And sometimes skin. Well, because that's the blood supply from the most to the least. I don't think that probably is related to the osteosarcoma unless you're on heavy chemotherapy.
No, she's doing, all she's on is gabapentin 3 times a day. She's on meloxicam, a small dose of that. We're still giving her cobalaquin. And then she still had some diarrhea off and on. So we've never been able to put her back on kibble. So she's getting Advita once a day.
Okay.
And we discovered olivo carrots, and that solved the diarrhea problem. But
Okay.
she's still on, rice and hamburger and pumpkin and carrots and whatever else I put in for nutrition.
So what I would do is get a sterile urine sample from the center of the bladder with a needle. And
Okay.
if I had ultrasound, I'd look at the bladder and see if it's structurally normal. And you can see back, it's just kind of a big balloon, and you can see back right to where it goes over the pelvis. And if the urine was clean and the bladder looked perfect, I'd sedate, I hate to sedate her, but I would at least try to do a digital exam, because there are a number of neoplastic processes that can occur in the vagina.
Yep.
Now, the positive thing about them is they're slow growing, and they only create a problem when they create an obstruction of the urinary output.
Yep.
And I think if
She's
she's
having
not,
no urinary problems at all. And in fact, no accidents in the house,
Okay.
all the other things we thought we'd wait for. So it would be time. She's not displaying any of those yet.
okay. And what my intuitive thought process, you can look a long time finding out what's there, but are you going to do anything about it?
Yeah, exactly.
Yeah. So it's a problem. In a year or two, you could have a big problem. Oh,
Yeah.
okay. All right.
Yeah. I mean,
I have a quick question. I don't want to interrupt, but Joanne, could the original diagnosis be wrong?
well, remember you had Dr. Kudo look at the x-rays.
Now,
But I'm not sure he got back to me. I'm not sure I heard back from him.
I thought he said he agreed with the diagnosis, but I'm beginning to wonder myself. She's
Now-
only 12. She'll be 12 in June.
I had a dog with classic lesions of osteosarcoma. No, it was actually chondrosarcoma, but they're going to look the same. We biopsied it, sent it to a pathologist. It was confirmed as osteosarcoma. So I had an X-ray and a biopsy. So, and the guy didn't want to take the leg off. We said, well, take her home. Hopefully you get 6 months or a year. So
Yeah.
1 year later, he comes back and said, I want my money back. Dog's perfectly normal.
Oh, God.
Okay.
Good
So,
luck with that.
Wow.
yeah, I didn't give him his money back. So I called him and I said, what's the story? He said, I took it to another veterinarian because the dog was no longer lame, and they couldn't find the lesion that you found.
Wow.
So I called the pathologist and I said, guys, did you screw this up? So they pulled it out, sent it to 3 independent pathologists, and it was positive. Then they did a literature search and found 6 dogs with spontaneous resolution of histologically diagnosed osteosarcoma.
Cut it out. Oh.
Now,
I mean, this
6
is a
dogs
dark
in the
road.
history of
Yeah,
the world.
we've been traveling a dark road for almost 9 months, and every day you're like, is she going to get worse? And she's little bitty things are showing, but I just,
But she's 12. Why
Yeah.
not?
I know.
As happy as can be.
I mean,
But when I spoke to
how
this,
do we know if she's okay in her legs? So we should do something.
well,
I'm
you
just-
know what I would say is look at that website from Ohio State University on quality of life.
Mhm.
And as I get older, I'm not sure if it's going to be my osteosarcoma or this or that, but
Yep.
you don't feel well, and
Yeah.
a dog that doesn't emotionally respond, and a dog doesn't eat, and they don't have urine and bowel control, and
Yeah, right,
I don't
right.
care what the heck the diagnosis is.
Yeah.
It's not
But-
good.
Yeah, but I'm telling you, all those other things don't seem to be happening. Have you seen dogs live a while with the diagnosis, even if it is the right diagnosis? I mean, Rolo was 7 months.
I would say up to a year.
Okay. Okay.
Now,
She
I've
looks
also
pretty happy.
1 week.
Yeah.
1 week.
Yeah.
And see, well, I think that as I recall, the dog that lived almost a year,
Mhm.
we argued about this lesion on the X-ray. Was it even significant?
Yeah.
And then we brought him back 3 months later, and it was significant. So if you see them, I had a dog I examined in the exam room and pushed my finger into the bone.
Oh, yeah.
Ooh.
Oh,
See, that thing was ready to go,
Yeah.
and I done such
I
a good-
remember when we brought Rolo in for you to put him down, and after he was gone, you lifted the leg and it bent. And you said, no, but you said he did break the leg. because that's what happened to him. He broke it just doing the simplest thing.
Okay, he jumped in the car.
Yeah, but we just, you know, I don't want her to break her leg, but I don't want to put a dog down that's not that sick either.
You know
Well-
what, Joanne? I'm wondering if you should get a second opinion now, even with an X-ray, not for her, but for you.
Yeah, I mean,
Yeah, I agree.
Where? I mean, I want to be able to trust a vet, and you know, Dr. Poling's the only other vet right now that I would trust.
Well,
Well,
and,
right, Texas. Yeah.
you know, but I'm convinced because those 4 pathologists in it was actually an IDEX practice. I think that they were sensing this could be a big problem, and they literally did a 1 month of research and sent me paper after paper after paper. So there are spontaneous remissions, and I don't know if it's faith healing or what the hell, but you know, it's a biologic disease, and
Yeah.
it can.
I've heard of it in people,
Yeah,
certainly.
that's exactly what I'm
So
saying.
maybe we'll get another
where there's
X-ray and see where
You
we are.
open up
I don't count on a spontaneous cure, but
No,
that would be
no.
number 8.
I know.
Yeah. But yeah, so maybe we'll get another X-ray and see where we are. Just.
Yeah.
All right. Okay. Thank you so much, and I appreciate, and it's great to see you.
It's right on the dashboard.
I can't see you, but it's great to hear you. You have so much information, and you know, I won't remember all of it, but I'll remember a lot of it.
Well, it's
So-
being recorded, so you can just watch him
Oh,
on
right,
YouTube.
that's right. That's
Right.
right. Good,
Are
Good.
there other questions?
I'm about to bail, but it's good to know everybody's there. I'll say that.
Okay, great.
Bye-bye.
Okay,
Bye-bye.
Patty wants to say something?
Just quickly, so I've had McKinley less than a year. She came with hookworm. I never had any of my previous greyhounds even check for hookworm, and they all lived to 15
no.
practically. So my question is, she's been on and off treatment for a year. To me, the Drontal and the Advantage is poison. What would happen if I just didn't treat it?
You mean the hookworm? Are you getting positive feedback?
Yeah.
Okay.
She had 2 negatives, and then we kept her on Advantage for 3 months, and then I brought one in for her physical, and she's got it
Positive.
again. Yeah.
Well, see, I think you rotate through these wormers, because I'm telling you, if you've wormed that dog properly with Drontal,
Yep.
Pyrantel, Panicure, that dog has resistant hookworm. I'm totally convinced, because if all we're doing is purging the larva, every time you treat them, you're taking another bunch of those hidden larvae out. Now, the dog that we treated for a year, if that dog went a month, it had bloody diarrhea, and it was losing weight, and it was hookworm. So that dog's inflammatory bowel disease was caused by hookworm, and it was bad enough, or the secondary bacteria associated with the hookworm, or gut damage done from a food allergy on top of that. You know, it's without the biopsy, you don't have definitive. If the dog is normal with no vomiting, no diarrhea, I would still treat that dog a minimum of every 3 months, so that you wouldn't have a sick dog in the future. I'm saying there can be long-term damage. So say, screw it. If the test is positive, the dog's perfect, treat the dog.
Yeah.
All right.
And-
It's just the Drontal, she's, after she has the Drontal, you can tell she doesn't feel well. She just
yeah.
mopes around. She won't eat. She's just like blah.
And I think I don't use much of it because I think that is a potent drug, but Pyrantel certainly isn't. Panicure certainly isn't. I mean, I think those are pretty mild drugs.
Yeah.
And this Simparica Trio, just switch to that as a preventive heartworm. You'll be worming that dog essentially every month.
Well, she gets Advantage,
Okay.
which is topical, and she hasn't been off that at all in the year I've had her. It's the Drontal that she goes on and off of. So
Yeah.
but
Well, but consider a different heartworm preventive that has the moxidectin in it. And I'm saying that because that's the study that Dr. Couto does and did. And it's published. Look in the Greyhound Initiative.
okay.
Okay, Rose Sullivan has a question. She has her hand up.
Just a hand up.
Can you hear me?
Yeah, a little pretend you have.
Yes.
Rose,
Okay.
go ahead.
Oh,
All right, can you hear me?
Yep.
Okay, we have a Greyhound Rocky, he's 9.5, and he has intermittent limping problem on his right paw. He does have 2 toes amputated on that from his racing days. We got him with 2 toes on his right front foot, and he has a lot of issues on and off when it comes to walking. Sometimes he has a small limp, sometimes a big limp. So on days that he has a big limp, we can't really walk him. But his vet has him on Rimadyl, 75 milligrams a day. And I'm noticing it really doesn't help the way it used to. What do you think about the issue? And do you recommend any other medication that might help him better?
Has he had his foot x-rayed?
Has he had? No, they have not.
And so the reason for that, I think, is threefold. If that x-ray is perfectly normal, I would try that low dose aspirin on that dog. Because that might be an intermittent clot problem. If that x-ray showed arthritis and it was really quite extensive, well, they don't call it degenerative arthritis for nothing. It gets worse. And almost to the point where the joint may have to fuse or be surgically fused to actually resolve it. You know, rough bone on rough bone hurts.
Oh, yeah.
And then the third thing I would look at is the density of the bone. I have seen more than one dog, and it's not specific to greyhounds, that the third digit is lytic. Those dogs have squamous cell carcinoma. It's totally curable by amputating the toe, and you don't want to treat it as arthritis because it will spread to the next toe, and then you're taking all the way up to the wrist.
Okay,
And
so
that's very easily diagnosed.
okay, he only
and
has
then-
2 toes left though on that foot. So, so I don't know if he were to have that, what the toes that are left are his 2 outside toes, the big one and the tiny little one. So he's
Sounds like you need to have an x-ray.
okay.
Yeah, I can get that x-ray because it's
Right.
going to show you, is it an acute, chronic? So even an infection would have a normal joint most likely until it spread. A chronic infection. In fact, I think chronic nail bed infection is what causes squamous cell carcinoma, because we screw around and treat these dogs with antibiotics and they get better, and 2 years later they come back. So I think it's like a untreated dental disease, and then you end up with carcinoma of the gum or sarcoma of the gum.
Is there a medication that Rimadyl for
Okay,
Well,
well,
Rimadyl is a pretty safe drug. It's anti-inflammatory. If it's not working, it's something more serious or different than you think.
okay, should we wrap things up, or should we have another time later on, or where are we at here?
This would be great to do this again sometime, Louise.
Okay, like how long?
One-
A month?
A month, yeah.
What do you think, Dr. Poling?
I think Dr. Hartman should lead the next one. She's certainly capable. And
No, we
Dr.
miss
Task-
you. We miss you. We missed you. So we can just get down the road and see Dr. Hartman.
Can you also tell us how we access this on YouTube?
Oh, we'll
Email
post.
it.
We'll email it.
Yeah.
Do you have my email address? That's louisecoleman10@AOL. But yeah, just email me, or we'll email you. Mariah, we'll put it on YouTube and then we'll send it. It'll be on my Facebook too. But no, we'll definitely do it. I just think that we just sort of got started. Dr. Poling's a great talker.
Yep. How we met him. Yeah.
Right.
We met him when he gave a talk at Greyhound Friends. That's how we met.
Of course.
go.
Of course. Yeah.
You just have to remember, you can only believe about 75% of that stuff.
Oh,
No, I say that in the sense that when I reviewed the literature for this, I learned 3 or 4 things that weren't there the last time I looked. So
wow.
everything
Wow.
you believe and know will probably be out of date
Will
soon.
change up. It definitely will change up. But well, congratulations on being so successful in Austin and that your practice is doing so well, and your morning kennel, and life goes
Yes.
on.
Great.
It's
We have to move to Austin now to see.
It's
Dr.
an
Poling?
adventure. It's an adventure. I do have cowboy boots.
One track.
You do? Wow.
You know, you're out of place if you don't wear them places.
Really?
Yep.
Wow. That'd be interesting. Huh.
They're very conservative.
Okay. Yeah, I kind of noticed that. Yeah, right. I think that I might, anyway, we'll see. All right. Well, let's see what we can do like in a month or, a few weeks, but yeah, definitely. I think that it was great to hear you. And nice to see everybody too.
Thanks
like
for
Michelle.
putting it together, Louise.
Thank you so
everybody.
much,
Bye.
Louise. This was
You're
wonderful.
welcome.
Thank
You're
you.
welcome. Great to see you all. Take care. Thanks, Rod.
Bye-bye.
Bye.
Take care.